Hi, I'm Tom Hare, physical therapist of 25 years and patellofemoral pain syndrome overcomer. This portion of the video is intended to serve you, the clinician, to best be able to utilize tools when treating your clients. Anterior knee pain can be categorized in three main categories. One, instability, which there's several surgical interventions for. Two, osteoarthritis, again, which has several surgical interventions, as well as the black box of anterior knee pain, which is patellofemoral pain syndrome. When fitting the Shields 2 patellofemoral brace, I tend to start using the buttress as a patella so I can demonstrate to the client which way their patella is moving. So in this case, the buttress is acting like the patella, these being the base points, this is the apex. Once you reference your landmarks, such as the tibia tuberosity, the apex I usually locate by going back and forth on it, finding the bottom portion of the apex, as well as the two base points. Then going back to simulating the buttress as the patella, there are several presentations that can happen, such as a medial glide, a lateral glide, an internal or external rotation of the apex, these points, or an external or internal rotation of the base points. There also could be a medial or a lateral tilt, as well as an inferior or patella baja presentation, or a superior or patella alta. Sometimes in the patella alta, it's because someone's wearing a tendonitis strap that will tend to stretch out that ligament. Therefore, applying the Shields brace, once the buttress is in place, and doing eccentric exercises will allow that joint to tighten up and to decrease pain and to allow increased function. When you're ready to apply the brace, we'll slide the brace underneath, apply the anchors, and once the anchors are in place, based on that clinical presentation of the patella, you can position the buttress where you want to. One of the great applications of the Shields brace is not only that is it universal, right or left, if an occasional application where there's a medial versus a lateral application, that can be accomplished as well. Once I evaluate the patella, I'm concerned with which of the two straps to put on first. Given the clinical diagnosis, I would choose an inferior strap when the apex was the more movable component that I was trying to correct. So then the application is the same, pulling at a lateral 45 degree, then you can reset the buttress, reset the force on the patella, and then apply it with the same 45 degree angle. After the application has been complete, I'll have the client continue to practice doing quad sets to see if in fact it feels more comfortable. Does that feel more comfortable? Mm-hmm. Usually I'll do a heel slide to show the client how that patella will effectively hold the kneecap in the position we want it to do, whether she's doing stairs and or exercises. I often use the example, if I could just hold your patella in the right spot, then you could be pain-free. The Shields 2 patellofemoral brace does that with the application of a properly applied buttress. I'm interested in hearing from you, and we've given you feedback forms inside the Shields box to be able to show us where you put the patella, what kind of exercises you were doing, and what kind of outcome you had within a 2 to 3 week period, as well as a 4 to 6 week period. I tell my clients, whether you're 8 years old or 80, it takes about 4 to 6 weeks to get in shape. So if you commit to your program, you're compliant with how the brace goes on, use it appropriately, you're going to be in top shape and be back at what you want to do.